Knee pain is super common in powerlifting and something that I've dealt with myself on and off many times. Here are 3 tips to help you avoid or clear up knee pain if you encounter it in training. Number 1, head and shoulders above the rest is load management. This should be a no-brainer, but this is by far the most important, and many of the other factors that you might be thinking about or hearing discussed actually just boil down to load management. Ask yourself, how much are you asking of your knees? If they are consistently hurting, the answer is probably too much. Some follow-up questions you could use to self-examine your own training might be, are you routinely handling intensities that leave you beat up afterwards? Are you doing that week in and week out? Are you maybe doing so many sets during the week that your joints simply can't keep up? Or, this is pretty common, are you squatting so frequently, maybe 3 times a week or even more, that you simply feel like you can't recover? These are super common problems that are fairly easily solved most of the time by simply pulling back a little bit on either volume, frequency, or intensity. I'll throw in one more bonus topic. Exercise selection actually falls under this banner as well. For example, do you find that maybe high bar squatting tends to beat up your knees more than low bar squatting because of the more forward knee position? In that case, you might try doing a larger percentage of your weekly volume as low bar rather than high bar. At the end of the day, load management really is king. Following that though, point number 2 would be technical considerations. Like I've said repeatedly by this point, load management is almost always the bigger culprit, but you can't ignore technique either. I would record and review your training footage or ask someone like a coach more experienced than yourself to assess your training footage for you and look for things like, are you fairly evenly balanced throughout the whole foot while you're squatting, or do you tend to be diving into the forefoot and your heels are leaving contact with the ground at the bottom of your squat? That's a very common culprit. Another one might be, while you're squatting, are you really focusing on forcing those knees forward, or are you fairly evenly distributed between knees and hips? And I'll throw in one more here. When it comes to knee pain, a lot of people like to blame knee cave as seen from the front, but in my experience, it's usually knee twist that's actually causing the issues. If you have really tight hips or are lacking specifically hip internal rotation, you might find yourself pointing your toes out quite a bit to try to make up for that. What happens is then the knees can't keep up with that really outward toe angle and they end up kind of diving inwards. And this over time can create a lot of torsion at that knee joint. The solution there that I've found quite often is addressing hip mobility and also pelvic position, not usually just throwing a band around somebody's knees. Try to match your toe angle and your knee angle as closely as possible. And finally, point number 3 is tissue tolerance. This is a much lower tier point than the other 2, but every injury can at some point be expressed as an equation where applied force is surpassing tissue tolerance. The first 2 things we talked about were about either reducing or redirecting the applied force on the joint, but it's also worth discussing making the joint itself stronger. The best places for this, in my opinion, are in your warm-ups and your accessory work. This might look like training end range positions in safe environments, think like knees over toe lunges, or just things that help build up the knee joint in general, like terminal knee extensions or hamstrings like glute ham raises. Well, I hope you found this helpful. If you have questions, leave them below and I will get back to you, and I will see you guys next time.